So very good afternoon everyone. I am Dr. Satyabrata, MDDM clinical pharmacologist, and today I am going to discuss on anti-VEGF agents, that is vascular endothelial growth factor agents. Coming to introduction, new blood vessel formation or angiogenesis is an essential property of cancers that is given by Fockman in 1971. Cancer cells secrete the angiogenic factors that induce the formation of new blood vessels that enhance nutrient flow to tumor cells. And angiogenic factors secreted by tumor cells include VEGF, that is vascular endothelial growth factor, FGF, fibroblast growth factor, TGF beta, that is transforming growth factor beta, PDGF, that is platelet derived growth factor. And VEGF, vascular endothelial growth factor, initiates endothelial cell proliferation when it binds to a member of the VEGF receptor (VEGFR) family, and a group of highly homologous receptors with intracellular tyrosine kinase domains that includes VEGFR1, that is FLT1, VEGFR2, that is KDR, and VEGFR3, that is FLT4. And the binding of VEGF, that is vascular endothelial growth factor, to its receptor activates the intracellular VEGFR, vascular endothelial growth factor receptor tyrosine kinase activity, and initiates mitogenic and anti-apoptotic signaling pathways within the endothelial cell. Then coming to anti-VEGF drugs. These are the drugs that inhibit the VEGF, vascular endothelial growth factor signaling by blocking VEGF ligand, vascular endothelial growth factor ligand, or VEGF, vascular endothelial growth factor receptor function. For example, bevacizumab, ramucirumab, aflibercept, sunitinib, sorafenib, pazopanib, axitinib, lenvatinib, and regorafenib. These are some examples of anti-VEGF drugs. Then coming to individual drug, that is bevacizumab. The mechanism of action of bevacizumab is that it is a humanized monoclonal IgG1 antibody, binds to VEGF, vascular endothelial growth factor, prevents interaction of VEGF, vascular endothelial growth factor, with its receptors on the surface of endothelial cells, and inhibits receptor signaling that normally increases vascular permeability and angiogenesis. Then coming to ADME, that is absorption, distribution, metabolism, and excretion. This bevacizumab can be given in intravenous route, 30 to 90 minute infusion every 2 weeks in metastatic colorectal cancer, and combination therapy in non-small cell lung cancer NSCLC every 3 weeks. The antibody has plasma half-life about 20 days, that is range 11 to 50 days, and this bevacizumab is indicated in metastatic colon cancer, non-small cell lung cancer NSCLC, cervical or ovarian cancer, metastatic RCC, that is renal cell cancer, glioblastoma, wet macular degeneration. Then the adverse effects of bevacizumab can be hypertension, gastrointestinal perforation, thromboembolic events, vessel injury, bleeding, etc. These adverse effects can occur with use of bevacizumab. Then coming to ramucirumab. Ramucirumab mechanism of action. It is a human IgG1 monoclonal antibody that binds VEGFR2 receptor, and blocking the binding of VEGFR ligands and thereby inhibiting ligand-induced activity in endothelial cells. And coming to absorption, distribution, metabolism, excretion ADME, it can be given in intravenously every 2 to 3 weeks, and its mean half-life is 14 days. It is indicated in case of metastatic colorectal cancer, advanced gastric adenocarcinoma, and metastatic non-small cell lung cancer, that is NSCLC. Then coming to adverse effects of ramucirumab: hypertension, diarrhea, hemorrhage, gastrointestinal perforation, GI perforation, and impaired wound healing, etc. can occur with the use of ramucirumab. So we should be cautious in using ramucirumab. Then coming to aflibercept mechanism action, it acts as a trap for VEGFR ligands, and it is a recombinant fusion protein that contains extracellular VEGF binding domain of human VEGFR1/2 fused to the Fc portion of human IgG1, immunoglobulin G1. It binds to human VEGFR ligands with high affinity, reducing their plasma concentrations to levels that are too low for significant activation of their cognate receptors. Coming to ADME, absorption, distribution, metabolism, and excretion, its half-life is 6 days. It can be given intravenous infusion over 1 hour every 2 weeks. It is indicated in case of metastatic colorectal cancer and hypertension, diarrhea, hemorrhage, etc. These are some adverse effects that can occur with use of aflibercept. Then coming to sunitinib mechanism action, it is a small molecule orally bioavailable inhibitor of multiple kinases including VEGFR2, ADME, absorption, distribution, metabolism, excretion. Typical treatment cycle is 4 weeks on treatment followed by 2 weeks off, metabolized by CYP3A4 to produce an active metabolite SU12662, and THAP is 80 to 110 hours, that is long, very long acting, and steady state achieved after 2 weeks, and pharmacokinetic not affected by food intake. And this drug sunitinib can be used in case of metastatic renal cell cancer, pancreatic enitis, neuroendocrine tumors, and GIST, gastrointestinal stromal tumor. The adverse effects of sunitinib can be bleeding, hypertension, proteinuria, arterial thromboembolic events, intestinal perforation, fatigue, hypothyroidism, bone marrow suppression, neutropenia, etc. So we should be cautious while using sunitinib. Then coming to sorafenib, mechanism action is like sunitinib, adverse ADME, that is absorption, distribution, metabolism, and excretion. So sorafenib given orally every day without treatment breaks, metabolized by CYP3A4, and THAP is 20 to 27 hours, steady state plasma concentration achieved within 1 week. And sorafenib can be indicated or used in case of this is a drug approved for hepatocellular carcinoma, and it can also be used in metastatic renal cell cancer. The adverse effects of sorafenib can be fatigue, nausea, diarrhea, anorexia, rash, bone marrow suppression, GI, gastrointestinal perforation, cardiomyopathy, palmar plantar erythrodysesthesia, etc. So we should cautious when using sorafenib. Then coming to pazopanib, mechanism action, kinase inhibitor of VEGFR1, 2, 3, as well as FGFR, fibroblast growth factor receptors, or KIT, and LCK, PDGFR, platelet derived growth factor receptor, and other kinases. So ADME, absorption, distribution, metabolism, and excretion, it is orally viable and metabolized by CYP3A4, eliminated with a THAP of 31 hours, and it is indicated or approved in advanced renal cell cancer and advanced STS after prior chemotherapy. So adverse effects can be hypertension, thrombotic and hemorrhagic events, GI, gastrointestinal perforation, QT prolongation, cardiomyopathy, black box warning for severe life-threatening hepatotoxicity, and it is contraindicated in elderly patients and liver function test abnormalities. Then coming to axitinib, mechanism action like pazopanib, and ADME, absorption, distribution, metabolism, and excretion, it is metabolized by CYP3A4, eliminated with THAP 2.5 to 6.1 hour, and it is indicated in case of advanced RCC, that is renal cell cancer, and the adverse effects can be hypertension, hemorrhage, GI, gastrointestinal perforation, etc. So we should be cautious while using axitinib. Then coming to lenvatinib mechanism of action like pazopanib, ADME absorption distribution metabolism and excretion, orally available, metabolized by CYP3A4, eliminated with a T-half of 28 hours. It is indicated in recurrent or metastatic differentiated thyroid cancer, advanced renal cell cancer. Adverse effects can be hypertension, thrombotic and hemorrhagic events, hepatotoxicity, gastrointestinal perforation, GI perforation, and QT prolongation, etc. So we should be cautious while using lenvatinib. Then coming to regorafenib mechanism of action, it inhibits the protein kinase activities of RET, VEGFR1, 2, 3, KIT, PDGFR, FGFR1 oblique 2, TIE2, RAF, RAF1, BRAF, ABL, etc. And adverse ADME, that is absorption, distribution, metabolism and excretion, it is orally viable, metabolized by CYP3A4 and eliminated with T-half of 28 hours. It is indicated, it can be used in case of metastatic colorectal cancer, metastatic GIST, that is gastrointestinal stromal tumor. So adverse effects can be hepatotoxicity, hypertension, thrombotic oblique hemorrhagic events, GI perforation, gastrointestinal perforation, QT prolongation, wound healing complications, etc. So we should be cautious while using regorafenib. Then coming to summary, anti-VEGFR drugs, that is vascular endothelial growth factor receptor drugs, used in various cancer treatment may be large molecules like monoclonal antibodies, bevacizumab, ramucirumab, etc., or small molecules like sunitinib, sorafenib, pazopanib, etc. And these drugs are used in combination with chemotherapy. So these are my references, and thank you very much for watching my videos and subscribing my channel. We will learn more and more. We will discuss more and more topics, new topics, and you will learn a lot from this. And you can go through different articles and guidelines to acquire more and more knowledge about these topics. So thank you very much. That's all for today. Thank you very much. Again, thank you very much. Jai Jagannath.